This week on Challenge Accepted, I'm gonna see what it's like to be a triage officer in an emergency room during a mass casualty incident.
Now this comes out.
Okay, sounds good.
The catch is, I'm not a doctor, and this entire hospital, it's not real.
We're putting Michelle through a real-life simulation of a 1-hour mass casualty incident. This is where real doctors, nurses learn. We've essentially designed a live-action hospital video game. Over 30 actors playing patients, real nurses, and doctors, where Michelle will have to make split-second life-or-death decisions.
50 micrograms fentanyl.
I'm worried about her. Her airway's close enough.
You're gonna make the vertical incision.
How do you tell someone that someone has died? We've seen it a million times on TV, but how close is it to the real thing?
Everyone needs a tag. Everyone needs a tag.
Find out on this week's episode of Challenge Accepted.
Simulation starts in 3, 2, 1.
We want to get to Southern California on alert this morning after getting hit by the largest earthquake there in 2 decades, sparking more than 160 aftershocks.
You can see the damage.
500 people were hurt.
All right, there's an earthquake, so we're gonna get people coming in left, right, and center. Ambulances, people walking in, crawling in, personal cars. Do we know how many are coming?
We have no idea, so we have to be prepared for anything, and that's where your triage skills are really going to be essential, that you need to sort all these patients that are coming in.
Okay.
My role as a triage officer is to quickly assess the patients arriving at the emergency department and assign them a color based on their injury severity level, with the hope of saving as many lives as possible.
So if you've seen the pit, what Michelle is going to be experiencing today during an MCI is very similar, with one big distinction. They're actors. They have lines. Michelle does not know what she's walking into. She has to rely on this one-day quick education that we presented to her. So I don't envy her.
Dr. Mike, good to see you again.
Good to see you, yes. I'm Dr. Mike Varshovsky, board-certified family medicine physician and content creator online, especially on YouTube.
Start chest compressions!
One of the most influential medical educators online, 25 million followers, the legendary Dr. Mike Varshovsky.
Dr. Mike is in our video! So Dr. Mike has the incredible experience of not only being a healthcare and science communicator, but also practicing every single week in the field on real patients. So I asked Dr. Mike to come in and make this simulation as real as possible.
In one day, we're gonna try and simulate 4 years of medical school to teach Michelle what to do during the MCI.
What you're going to be going through tomorrow is very similar to what we train all our emergency department staff on.
Yes, I'm a doctor. I'm a family medicine physician. So the training I have doesn't really prepare me fully for an MCI. It's the experts like Ryan, like Brett. They're the ones who have the experience to not just practice it in real life, but also to teach it on a very high level to doctors like myself. So I'll be getting a lot of value today too.
So we're going to teach you how to sort patients so that we make sure that we can do the most good for the greatest number of patients possible.
How do I do that? So there will be 4 categories I can sort patients into.
Whoa! What the?
So we have a simulated patient here.
I can do
Fortunately, there's a tool available. It's called Start Triage, and we have a flow chart here that will direct you through the algorithm.
I love flowcharts! The START Triage flowchart gives medical professionals a starting guideline to quickly assess patients as they are brought into the emergency room.
Starting with the green, we have the patients that are going to be your most minimally injured.
The first question is the patient able to walk? If yes, they're immediately assigned to green. Please walk towards me. Yes, that's already green.
Easy.
Bam.
We're done.
Ow.
Going on to yellow, this is called delayed. So the patients that are definitely going to need care, but they don't need it right away.
Yellow means the patient cannot walk, but might still have stable vitals and mental status. Breathing, they are breathing. Respiratory rate is less than 30. Okay, perfusion. When you check for perfusion, you push down on their nail, and when you let go, if it goes from white to normal color in less than 2 seconds, we move on to check their mental status. Can you wave your hand? Okay, so yellow, final answer.
The red patients are going to be your most critical patients, the ones that need immediate medical care. They have something that you're detecting as abnormal in either their breathing rate, their perfusion, or the way that they're responding to you and following commands.
They're not walking. Heavy breathing, respiratory rate is
40.
high
Pretty fast.
respiratory rate, that's red. These are the patients that have the most emergent needs.
The black category are the patients that are either deceased or, unfortunately, there's not a lot that can be done to save them. It doesn't mean that we ignore them. We're still going to provide palliative care, but unfortunately, just there aren't the resources available like there might be on a daily basis. He is not walking.
Okay, are they breathing?
So
Able
he
to
is
breathe?
not
No.
breathing.
Can we position their airway?
So you would go over there, do a head tilt chin lift.
This does not include CPR.
Unfortunately, again, because we only have 1 minute and we don't have the resources to devote that many people and that many resources to a single patient at this point.
But I like where you're going.
Okay.
I like that you're thinking about it.
Okay.
So unfortunately, we're gonna have to tag this patient into the black category.
That sucks. I hesitate to put the black wristband on a patient.
It can be extremely challenging, and this algorithm helps you do a calculated evaluation on them that takes the emotion out of it.
After the incident, people start to break down. They have big emotional outbursts because they were putting away their emotions for so long. So expect after your simulation tomorrow to feel quite stressed out.
Simulation starts in 3, 2, 1.
Let's get started with our first set here.
My first challenge is to perform triage on an incoming wave of patients who were injured in a collapsed apartment building during the earthquake.
Ma'am, are you injured? She's walking, so it's green. I'm just gonna put this here, but if you're able to walk, go ahead and head this way.
Excuse me?
Where do you feel pain, sir?
My knees are all cut up.
Okay. Hi, are you able to walk towards my voice?
Yeah, I'm okay. You can probably help somebody else more than you can help me.
Okay. Well, I'm just gonna tag you here. This is gonna tell us how to treat you in the hospital. Please head in this way.
Pull this thing out?
No, do not touch it.
So the first couple of people I see, they're walking, they're breathing, they're talking, they're responding, green.
Are you able to walk towards my
There's
voice?
confusion here. There's confusion.
Why? What
Use
is happening
airway.
here? Why are we here? She's breathing. She has airway.
Yeah, she's talking, but
Let me
there's
just feel your
confusion.
wrist. I don't know what to tag her because she can walk, but her mental stats, I'm gonna say yellow.
You have another patient. You have to be quickly. Get your staff to help out. Michelle, your patient is leaving.
Oh my God.
But then the cases start to become trickier and a little more complex. Like a patient who appears and they're able to walk, they're able to talk, but they don't seem all there mentally. Trying to triage this patient is sort of like trying to have a conversation with someone while also doing a math problem in your head, because I am trying to calm down the patient, at the same time trying to visually remember what the flow chart looks like and how I'm supposed to assign them.
Ma'am, you have lots of cuts. We need to take care of you.
cuts?
Yeah, on your forehead.
Cuts? Ah!
These are humans, so they're going to give you imperfect answers at times. So when you're trying to evaluate someone's mental status, you say, give me a thumbs up. They don't give you a thumbs up. You can miscategorize them.
Hi, what are you working with here? Okay, can you hear my voice? Their guts are coming out of there.
Yeah,
Okay.
that not important.
Okay.
What's
They can't
important?
Walk. They can't walk. Okay, I'm gonna put a red on this.
Okay, based on what? What do you
Based
do?
on short of breath,
Breath,
can't
what,
walk.
What are we getting breaths-wise here?
He's breathing really slow, actually.
He is breathing really slow.
Okay.
Okay, so you're going red, okay.
Okay, I'm just gonna
That's
use...
okay.
But triage isn't my only responsibility. It is also my job to perform procedures on the patients that are most high risk, that I categorize as red.
When you're in front of the hospital, you're triaging. When you're inside the hospital, you're treating.
So this guy's got an evisceration. He's full blown on oxygen. Still able to wake up a little bit. Sir, are you still with us?
What do you think of the vitals so far here?
His heart rate is somewhat elevated.
Yes, he's tachycardic, but what is the issue right here?
We need to cover and dress through
Yes,
it and call
do you want-
surgery immediately.
let's
Yes,
do
we
that
should
right
love
now.
it.
So we're gonna take a look at a patient that has an evisceration. And an evisceration happens when you cut to your abdominal wall and some of your bowel comes out. Yeah, so
It's a really bad day.
it is a bad day.
You do not want to ever push the abdominal contents back in, because forcing them back in is actually not the correct move.
So this patient is gonna have to go to the OR and see a surgeon to get it put back in. But what you're gonna do is you're gonna try to preserve the bowel.
All of the medical professionals in this simulation are actual doctors and nurses who have been instructed to carry out my commands, even if I'm wrong.
But what you want to get first is a big trauma dressing. This is sterile saline, and you're just going to pour some in there. Now go ahead and pull it out and cover the bowel with that.
We are just going to cover the wound for now and prepare you to go into surgery.
And now this is like an
What?
inclusive type of dressing that's going to help keep that moisture in.
Oh gosh,
So
it
we can,
has a very strong smell.
yeah, there we go. Let's put one there.
Goes over.
Now I want you to grab that roll of tape.
Perfect.
Okay.
Yeah, there you go.
Thank you for the assist. Okay, did we call the OR? Can we call him?
Yep, I'll call the OR.
Thank you.
Okay, we'll get the OR prep. Okay,
Okay.
move on right away.
Michelle, how are we doing in here?
We're done here.
The real Dr. Khare is actually not me. It is my dad. Growing up, I was actually on a course to become a physician, just like my dad. Instead, I became a YouTuber. So doing this episode is my one opportunity to hopefully make him proud. Also, my dad says to subscribe, so doctor's orders, you better subscribe.
The biggest issue that I'm seeing in Michelle right now is that she's making mistakes triaging patients.
Sir, can you hear my voice? Yes. Okay, Brad.
I'm starting to see emotions creep up, panic set in. She's freezing.
Can you walk towards my voice? Can he walk on his own?
Yeah.
Okay, that's a green.
Yeah.
Okay, he has
Green?
a chest injury.
Yes.
See that?
Well, okay, chest injury. But he's walking, but he's not walking by himself.
Does anyone know what they're
And red. Okay, I'm just gonna do red on that.
Once you miscategorize a patient, you're starting to give resources to that patient they didn't need. You could be losing resources for people who can be helped. This is the domino effect that if you make a mistake early, it can cause you a lot of harm down the line.
Hey, can we get some
Can you
help?
walk towards my voice?
My wife cannot walk.
Okay, they can walk, so they're both green.
Somebody over here, please.
Okay, okay. My name is Dr. Khare, and we're gonna treat you inside. Keep going inside.
After I assign a color to each patient, they will be put into a room based on that color. Now, each of these rooms have limited beds, staff, and resources. And the problem is, if you miscategorize someone, it creates a chain reaction of problems in the future. For example, if a patient is over-categorized,
Green, red, idiot.
that patient will end up taking resources from someone who needs them more. And a patient who is under-categorized will ultimately not receive the resources they need and thus be at risk of death. So this is kind of like a resource allocation challenge.
It sure is.
Okay, how do you feel?
That was so overwhelming.
Remember, you have secondary triage always after the fact.
Okay, I'm gonna be more confident.
Good.
Okay.
While mistakes are bound to happen because patients are going to be changing their severity level, usually that severity only gets worse. That's why there's always a consideration made for secondary triage where we can adjust for that and catch those mistakes early.
We're just sort of wondering when we can be seen.
We're gonna get her on some vitals. Maybe just see if any of those guys down there might know where he is.
When inside, try not to run. Very easy with sharps to get hurt.
Okay.
Remember, take care of yourself first. All right, start.
Vomiting with head trauma. Can you tell me what happened?
Something felt like a beam.
A,
or
B,
something.
C, you have patients.
I'm going to teach you this basic trauma assessment. It's called the primary assessment. So first thing you want to know is just, do I have an airway? So that's A.
Airway clear, I'm gonna check breathing.
The next one is B. It's breathing. Now we're seeing if their breathing is effective.
Breathing is okay. You hear good breath sounds on both sides?
Yeah, I mean.
Do you want me to double check?
Yeah.
And then after that, we're going to move to circulation. There's two big things you want to know about circulation. One, you want to know if they have a pulse. And then the second thing we're going to check is we're going to look for any major bleeds. And so now we've done airway, breathing, circulation. Most of our problems are going to happen in those three areas, and we'll have to address them to save that person's life.
Is there a reason why you classified her as red? We could secondary triage her and
I
change
think we
it.
need to move her down to yellow. We only have so many beds.
Yeah.
So I just wasted 2 gurneys.
Yep. Make moves.
Okay.
If you put someone into the red zone when they should be in the yellow zone, just switching them could cause people to lose their lives. You're using staff to mobilize those patients, and that can be really difficult.
It's gonna be this female right here. So she's been complaining of blindness in her left eye and some pain.
And I just have a lot of pain, and also my right ankle, I can't.
She cannot walk. She's blind in one of her eyes. She's got glasses sticking out of it.
And the pain's really starting to kick in. Like, is this gonna be like forever thing? Am I not ever gonna be able to see out of my eye? I'm just freaking out a little bit.
Okay.
It's okay.
Yeah, I understand.
Can we get some care? Like,
So right now,
Now?
are you okay if I just put an IV in and
I
give
can
her some
just
pain
two
medications and we'll keep
milligrams
her
morphine
monitoring?
again?
Her? Okay.
Yeah, okay, great.
I
we'll
will
get
make
some
that
morphine
happen.
and it'll help with the pain. Okay.
Okay.
It's gonna be.
I try not to lie to patients, right? I don't say you're going to be okay. But I do try to, I think reassurance is very important during this stuff.
It's gonna be. It's. We're doing the best we can.
Okay. Thank you so much.
Okay.
This gentleman here has some abdominal trauma. He had a
I'm
crush
fine. Just find
He's
my
saying
people.
He's okay. I need pain medications and a CT scan.
Okay.
Does that sound good?
I agree with that.
4 milligrams sounds good.
We're just
What are
waiting
you
on
doing
that.
here?
Nothing. Literally nothing. Keaton Everett.
He was the
And-
lead in the construction site. He's concerned about his men.
Okay. We'll just give him something for the anxiety.
Anxiety. Wouldn't you
Distress?
order for pain?
4 milligrams morphine. Okay.
Is he allergic to morphine?
Are you allergic to morphine?
No, I'm.
Then I think we need to prioritize other patients.
Okay,
We
then
move
you
on.
can do it.
Oh my God. Okay.
Okay, what are you doing? What are you doing? Ask questions,
Okay,
ask
what's
questions.
going on
She's
here?
unresponsive. If you need to manage your airway on the EMS gurney, feel free to do it.
Mike,
You want to listen? You want to listen first?
Yeah.
Listen?
Yeah.
Get some vitals. So there's a lot of things that can be happening that are disruptive that you can't even plan for. Being pulled in one direction, then another direction is really difficult. How much should they be squeezing?
Okay. Every 6 seconds, right?
Yep.
Okay. And then we should prep an IV for intubation so that we can give her medication so we can intubate.
Okay.
I'll get an IV started.
Okay.
We're going to work on intubation, and that's where we're going to secure somebody's airway. We would have to put a tube down their throat to help them maintain their airway. But the other thing it could be used for is breathing too, because if somebody's not breathing, we could breathe for them. Your vital signs are coming up. Her SATs are terrible.
Okay,
They're
stats are
80.
terrible. You
Can I
need to
get
get
IV stuff?
quickly.
Non-dominant hand. There we go, because you want to control the tube with your dominant hand. And this has to be in a
This
place that you can see it, not where the nurses can see it.
I am ready. Yes.
Okay, 120 sucks us in.
Okay.
You have your monitor. What are you looking for? What are you seeing?
I'm looking for the epiglottis.
And then just slide that in there. Nice. You see, that's the epiglottis. There you go. Try to hit in the middle of the epiglottis. Back up. Oh,
tooth.
I heard teeth.
Oh!
I just broke someone's tooth.
Malpractice.
Okay. Oh my God.
And you're going to take that.
And then this is the twisting thing once it's in there.
Twist it. There you go. Push it just a little bit further. Boom. Okay, good. Now then, pop this out with your thumb.
Out towards the stomach. Out towards the stomach. Out.
And bring it forward. Grab it with your other hand.
This?
Good. So then I will come up here. And bagging it means assist ventilations.
Attach. Put on your stethoscope. Put on your stethoscope. Quick. Check the stomach first.
Okay, it's not in the stomach.
Okay.
Good on
Chest
the
rise is
left
present.
side? Good on the right.
O2 sats coming up to 94.
Okay, that's good.
Okay, do you want them to secure the tube?
Yes, secure the tube.
She's stable. What do you want to do?
Now we need to push 50 micrograms fentanyl, 2 milligrams Versed, and a propofol drip, please.
Okay. Do any
Can someone
imaging?
repeat that back to me?
Okay. 50 of fentanyl, 2 of Versed, propofol drip.
Yes, please. Thank you. Okay.
During an earthquake, you're having all sorts of scenarios happen at the same time. But then you're also having really surprising incidents. Seeing a young child, someone you feel bad for.
Hi, can you hear me? Can you come towards me? Okay, she's able to move.
Okay.
Let's see if she can walk. I can't walk. You can't walk. Let me feel her pulse. Let me see your wrist. Did that hurt?
Okay, you have multiple patients.
Okay, got it.
There's lots of different people speaking lots of different languages.
Sofía, niña, Sofía, ¿dónde está?
Okay.
Lo siento, hablo español muy malo.
She walk?
¿Sabes
Can she
dónde
walk?
eres? No. She doesn't know where she is.
Mija, Sofía, ¿dónde está?
¿Tú no sabes dónde eres?
What do you think about that?
Fracture, which she can breathe. She has a pulse. I think it's yellow. I think it's yellow.
Okay, fair.
Yeah,
Tell your
¿dónde
staff,
está?
tell your staff. And that's why during an MCI like this, you have to be prepared for absolutely anything.
My water broke about 20 minutes ago. Okay.
Michelle,
Can we get a stretcher for her? Her water just broke.
Michelle, there's 2 people.
We're still going to have patients that are coming to the hospital for other things that were not related to this specific incident.
We should still triage them because we're overflow.
Correct. It's for everyone because it is balancing the resources that are available for everyone with the number of people that are coming in.
Hi, can you talk to me?
Yes.
Tell me what your name is.
Genevieve Fink.
Okay, and what's going on?
My water broke 20 minutes ago.
20 minutes ago. Are you having contractions right now?
Yeah, I started this morning.
How far apart are they?
2 minutes.
2 minutes. Okay. Yeah, let's proceed with green.
The lady's going to deliver a baby, I think.
Do we have no OB room open?
No, I called
You want to
OB.
put her in the room?
I called OB.
Yes.
And
And any response?
Put her in the room?
No.
I'll call him
We need
again.
to escalate that then.
Why did you change to red?
Because she's about to deliver a baby.
Okay.
That's not on the algorithm. I don't know what to do about that.
So this patient is about to give birth. But because of all of the mistakes I've made over categorizing people, all of the operating rooms are now full.
See, her contractions are getting closer and closer. Like if she starts to deliver, I told her we're gonna have to cut her pants off. We're out in the open, so.
Meaning I now need to perform a procedure on one of the red tagged patients so that I can create space.
Yeah. I'm seeing what I'm seeing.
I got another coworker. I still haven't been told what's going on with him.
This is not going well?
I'm worried about her. Her airway's closing up. Her
Okay,
airway's
so we need to
just
get to the
swelling
airway.
up.
We need to do rapid intubation.
Yeah, I mean, we could try.
Yeah,
She's
but
got
look
a
at the
lot
swelling.
of swelling. And she's like,
Can we go through a cric?
I would, that would
Okay,
make sense.
Then we need to prepare for a cric.
Okay, we're waiting for you. When you're ready, he's ready.
Okay,
you ready?
great.
Shot.
I need the scalpel.
There you go,
And
okay.
this. Right now I am going to be feeling for the thyroid cartilage.
Good.
And I'm going to make the vertical incision between thyroid cartilage and the cryo ring. Okay, I'm cutting through the skin now.
It just seems like after the pain medicine, she started to feel really dizzy. Ow! Sorry, my dear. Call you. We're gonna get her into the yellow. We need to order her lying down.
Okay.
I think this is right.
How far are you going to push this in?
Just a few inches so that we don't
Yep.
go down into the lungs.
Correct. Is that the direction?
Thank you.
Can somebody pay attention to me, please, for a moment?
Hey, you're last in line, bro.
Dude, I got here f***ing before you.
I don't care. He can't feel his legs.
She can't see.
Okay, can we prepare a syringe so I can inflate it?
Tube. Put up on the tube.
No! Can we just have you sit down?
Now this comes out, now this comes out, now this comes out. And
Sounds
switch
good.
the CO2 onto that.
Okay.
And I promise I will call them and we'll make sure that she's
You
taken
will
care of,
call them?
okay? Yeah.
They have not been
The
called?
longer that I speak to you, I can't get on the
Okay,
phone.
but can
Please
you-
take a seat and I will call
How have you not called me when we talked about it like 20 minutes ago? Yo, dude, get back in bed.
The baby's coming.
Get back in bed.
So, hey, what's going on here,
Get
guys?
back in bed.
Hey, real quick.
Okay, gold is good. Let me listen to see if it's working.
Okay. What are you
Well,
listening for?
I'm listening to make sure that it's both lungs and not just one.
Louise?
Wait, I know you. Wait, I know her.
Hey, my dear, this is an emergency. Go
I
down.
just. Why are they just shooting at me? What is that?
Repeat back. I think it's working.
Okay.
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 Brett,
We're-
do you
we're
feel good?
trusting you.
Yeah, I'll check it out.
Okay.
Okay. Should I see? Hey, can we get the OB kit?
We have got to get her jeans off because that baby's
Yeah,
gonna
I know,
come
I
out.
Yeah, I think she's gonna deliver any second.
What do you think? Should we cut her jeans off?
Where's my doctor?
Get the scissors. All right, come on.
Okay.
We did a video on how to deliver a baby 2 years ago. But that was 2 years ago. I don't remember anything on how to do this.
Do your best.
Okay.
Open the kit. Start the process. Ma'am, Dr. Kari's here. She's going to do a great job.
My back hurts so bad.
She's going to cut your jeans, okay? Set this up.
This is crazy. This is actually crazy. So we should cut her clothes off.
Yes.
Hey, listen real quick. OB just called. They are upstairs. The doc said he'd much rather deliver this baby upstairs.
I would much rather
Okay,
that too.
can we
Are
get
you
her up
okay?
there?
Is she stable enough for that?
Yes.
Or do you want to deliver here?
I think she's got to go
Yeah,
see
the
an
doc
upstairs.
says it's
Okay.
much better
Okay.
upstairs for this.
Okay.
I'm
for this
really-
delivery.
Tell the patient. Tell the
Okay.
patient.
Okay, we're
Okay,
sending
we're
you
headed
to
up
the
now,
OB.
okay? Give us 5 minutes. We'll be there in 5 minutes, okay? Okay, thanks.
Oh, thank God.
Easy breaths, easy breaths. You're doing well.
But the chaos still isn't over. While I was treating my patients, my staff was triaging even more patients who were now flooding into the hospital.
Mom! Mom! This is Mom? Hey, Mom? What's Mom's name? It's Ruth.
Hi, Ruth. It's Jack. Hey.
The hospital is quickly approaching critical mass with every room at full capacity.
If my wife goes blind, I'm gonna sue you guys. Like, I don't know what to tell you.
You're important, bro. We get it.
No,
You're the most important.
We've been here
We get it.
4 times longer than you, dude.
I just checked in on this.
You're still in line?
What position in line? How do I know if we're moving closer or farther? And all these people are coming, we just get bumped down again and again. My wife's gonna go blind.
I just checked in,
Michelle,
and
this
that's the
patient
best we
doesn't
can
look
do.
good. Do you want to check vitals?
That's the best you could do?
It's the best we can do. There are tons of people here.
Yeah, I see that. We've been here longer than all of them.
I think what's really difficult to grapple with is that on a normal day in the emergency room, many of these debilitating injuries could be resolved. But because it is a mass casualty incident, you have to pick and choose and ultimately try to save the most number of lives possible. This means making really difficult decisions like choosing to allow a patient to go blind because those resources need to be used to save the life of someone else. This is a patient that I miscategorized. Maybe she could have gotten treatment sooner if I hadn't messed that up.
I'm leaving.
Sir,
I have scratches on my legs, and I have a dog that's locked in.
These are all her current vitals. She got 2 milligrams of morphine, and she has an IV in place.
She's still looking for a child.
Yeah.
Did we call?
What about the young child that came in earlier? Could that be her child? Please, Michelle, they want a CT
Okay,
scan.
we got a CT.
Ma'am?
It's very easy to freeze, to feel overwhelmed. And I'm worried about Michelle feeling that emotion in the midst of all of the drama that's ongoing, patients screaming, family members getting angry about time. Hello?
Oh, I didn't close it. Sir, if you continue to raise your voice, I'm gonna have to ask you to leave. Please, please, please cooperate with us.
Come on, squeeze, 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 squeeze. You need to be able to snap yourself out of it quickly in order to respond to the call that is your patient's.
Can you talk to us? Started BBM. Can you wake up? Can we just move him down a couple more inches, get her out, and then we can put him
I want to
there?
take a look.
Sir,
You called him red, but he's agonally breathing. He hasn't been responsive since you've seen him.
Then I think we have to move him to black.
Okay, make choices, make choices.
Due to my mistakes, every red room is completely full. And there was a chance that if I had been more efficient with my resource allocation, there would have been space available and we could have saved this patient. But I didn't. And so I have to make the really difficult choice to give him a black tag. Having to be so objective about black tag is horrible, especially in a situation where if it wasn't an MCI, we could have done chest compressions to try and save them. But to actively have to say, we have to walk away from this person, that's so hard.
So we will have to get the name, which I'll go get with the EMTs just for the toe tag.
I feel so overloaded with stimuli and decision-making fatigue that I feel like I just need to sit in a quiet room and look at a wall for a few hours.
Yeah.
I have no good news for anyone, and emotionally, not being able to provide closure is very difficult for me and in general. Brett?
Yes.
The black tag patient that came in,
Yeah.
was he at the construction site with the other two?
They are. That is part of the construction crew.
With HIPAA, are we allowed to tell them? Just making
Your
sure.
call on this.
Sir, can you hear my voice? They did recover Brunson. He came to the hospital, but when he arrived, he was unresponsive. He's unfortunately passed. I just wanted to tell you, because you were asking about him.
Thank you.
I'm very sorry to tell you this news.
What we're gonna experience and show the general public with this MCI is happening at scale with our healthcare system. We are facing a tremendous shortage, stress. difficulties trying to give them care with limited resources. So if you don't want this MCI style of healthcare, we need to make changes, and I'm hoping that it starts with being kind to healthcare frontline workers, being gracious when you're going in and understanding that they too are humans first and are under a tremendous amount of stress. Second, understanding how beautiful and limited life is, that it can be pulled away from you at any moment, and you need to be grateful for it.
You ready for your grade? Okay.
If we had to break up the categories for which we grade Michelle, if we start with triage, so we're gonna have to give her an F on that one, because there were times where she was a bit panicked, she was starting to get caught up. Treatment, I'll give her a B-. She didn't know exactly what to do in a lot of the scenarios, not surprisingly so. But then where she really was shining is in communication.
Just being able to work with your team and to move people around and to prioritize and to keep checking in, that is really what would save lives in a situation like this.
For a human being to have to be the decision maker, even just today having like the microscopic taste of what that means and what that feels like, I have infinite love and admiration for anyone who does this profession.
Most people at any given moment are not sick. But I can say with 100% certainty, there will be a moment where they will be sick, where they need care. Think about habits that you can change in your life, that you can improve your health to perhaps have a better quality of life for longer.
This episode is dedicated to healthcare professionals everywhere who save lives every single day in real life. If you enjoyed this episode, please consider subscribing, and you can check out this other episode I did where I worked a real 24-hour paramedic shift in a real ambulance. If you enjoyed this episode, I think you're gonna love that one. Till then, I'll see you in the next challenge.